Hey, I'm Dr. Ruth Roberts. And with me, although he bounced out just for a moment, is Fausto Simoes. He'll jump back in a second, unless he's had some bizarre internet tragedy happen. But I'm really excited to introduce you to him. Uh, he is currently he just graduated from the Holistic Pet Health Coach certification program. He is also a certified professional canine nutritionist. And he went down this path because his dog, Tiffany, um, he got told that there were kidney problems. And oh, just watch it and see how things go, and then we'll go from there. So there he is. He's back. Um, and Fausto, good to see you. I know we all hit the wrong button sometimes, so easy. But I
Great
was
to see
just
you too.
kind of going through a little bit about your experience, your bio. Um, so he got this news about Tiffany, and that sent him down the rabbit hole of figuring out that there had to be another way. So welcome, and so glad you're here. What happened with Tiffany? You guys went in, and what happened?
Thank you so much, Dr. Ruth. Yes, when Tiffany came into my life, she was like this little alien that came into my life. I had no idea how to take care of a dog, and obviously, the only rational thing to do was to look at a Petco and a Chewy and go to a pet store and look at those beautiful images of kibble and like try to choose what would feed her. And then when she was a little less than 8 months old, she always had problems with her stool and she never wanted to eat. It was just always a major fight to get her to eat. I had to like go down on my knees and like pretend I was eating her food. It was crazy. It was really challenging. And then when she was a little less than 8 months old, she had this really like severe diarrhea, and then I panicked, and we took her to the ER, and they wanted to do an ultrasound, and I authorized the ultrasound. She ate something that did not go well, but they when the ultrasound they found that she had a physical abnormality in both her kidneys. But don't worry about it. You don't need to do anything. Just make sure you tell her primary care vet that whenever she has a surgery or she needs to go on medication, that they know about that. When they told me that, that stuck in my mind, and it just like took me into these rabbit holes, and I started to like do research. And thank God I ran into very important people in my humble beginnings of feeding fresh food. The dog walker that helped me at the time, she was this amazing person. Her name is Justina. And then this great woman that owned a holistic pet store in New York, her name is Taz. They both helped me like to give me a lot of information. And then this way I started to like dig in. And then I started to like come across like you and Dr. Karen Becker and Dr. Judy Morgan and Dr. Conor Brady and the Raw Pet Medics and like everyone that Rita Hogan, like everyone that uh, uh, we hear from today. And that's how the journey started. And then when I learned about your program, that's when like things trigger. I said, well, I want to like be able to, I want to do a program that will teach me. And I think you said something that really got to me a while ago. Yeah, I think you were giving a speech or an interview to someone, and then you mentioned about like the projection of the vet industry in the United States for the next 15 or 20 years, and how like uh, uh, the supply and demand are just not going to match, and like people are not going to have access to our vets. And then I said, well, I need to learn the basics. I need to learn how to take care of longevity and health. And then I read about your program. I had a couple of phone calls to discuss a little bit and understand a little bit more. And I was completely sold on your program because I thought, well, this is the place that I'm really going to get like the information that I need to make sure that Tiffany is, it's set for success. And then when I joined the program, I learned that the actual program, the pet health program that you put together, is way more than just giving information. is giving the whole infrastructure of community. And so that was like, for me, it was like this major thing. And I was completely amazed by the time I graduated. It was just like, it gave me so much confidence that now I can just really, with confidence, look at Tiffany and even like help other pet parents that have absolutely no idea. And I see a little bit of me looking at this little alien dog in my house, and now I'm able to help them too. So thank you for that.
Oh, it's absolutely my pleasure. And we had the pleasure of actually meeting in person in October last year at the Feed Real Summit. And in
Yes.
fact, and that was awesome. And then amazingly enough, there you were 2 months later signing up for the course, and I was
Yep.
so delighted. But you also completed the certified professional canine nutritionist program through the Feed Real Institute. So, I mean,
Correct.
when you went to figure out how to help Tiffany, you dove really deep and
Yes, I did.
went into it. And so,
Yep.
how have those two programs supported each other? Because I mean, that's a crazy good course that they're
Yeah,
offering.
I think they're they complement each other really well because the Feed Real Institute program gives you a lot of nutritional, like we would talk about all the macronutrients. So like we get like this amazing basis on how to and what to feed your dog. So it has this like amazing informational approach of a nutritional, and then when it combines with your program that is like this amazing like macro level, like it gives you health, and we learn about all the systems in the body, and we get all the support from other pet health coaches and access to you to help us guide on our decisions and advice. So I think for me that was it was an amazing experience. And besides that, like I try to travel to summits, and I'm going back to the Feed Real Summit in October. I'm going to Dr. Judy Morgan's event in Orlando, also in October. So I try to attend and be up to date with most things that they are being offered these days regarding pet health.
And that's amazing. I mean, you're an incredibly dedicated pet parent, and I'm glad you mentioned all the events. We're going to be sponsoring a booth at Dr. Judy's event for
Yep.
the holistic pet health coaches, so you can come and meet folks there. We'll be there in San Diego at the Feed Real Summit. I'll be a member of the Q&A panel, which is exciting.
Yep.
We'll have a booth there as well. And then this September 8th, we are putting on our own event in Chicago, Illinois, Sunday, September 8th. The first part of the event will be continuing education program for the certified holistic pet health coaches. And then in the afternoon from 12:30 to 5-ish p.m. and probably a little bit later, we will be having a pet parent facing event called Know Better, Do Better. Super excited about this. It's been just thrilling to be able to put this together and have all these amazing experts come in. And I'm going to show you kind of what we got going on here. But it's really cool. It'll be at the Morgan Arts Complex in Chicago. That's in the downtown area. The ticket sales will benefit the Citizen Canine Rescue in LaGrange Park, Illinois, which is a rescue focused on senior pets. I'll be speaking. Amy Renz with Goodness
Oh,
Gracious,
wow.
also
Yes.
my partner in crime in putting on this event, will be speaking. Doggy Dan Rubenstein, Chicago's own advisor to the stars, and the founder of the Pups Pet Club will be there. Dr. Rob Silver with Feed Real Mushrooms will be speaking. Dr. Odette Suter, also a Chicago native, will
Yeah.
be speaking on the microbiome. Beth Rinciar, one of our holistic pet health colleagues, will be speaking on how to handle emergency situations. And then Chelsea Kent with Solutions Pet Food, Parsley Pet, and the Food Regulation Facts Alliance will be speaking about a really cool test that you can use to help optimize your pet's health through nutrition. So this will be super cool. Check out the link. We'll have several exhibitors, including Real Mushrooms, Standard Process. Dr. Suter, I think, will be there signing her book. Parsley Pet, goodness gracious, Animal Biome's going to be sending some amazing goodies in our swag bag. So is Gussie's Gut. So it's going to be a really cool, fun event. So again, September 8th in Chicago, Illinois, 12:30 p.m. till 5 p.m. You'll have plenty of time to meet fellow pet parents, meet the coaches, meet the exhibitors, and talk to people. So that's going to be really slick too. But so I just wanted to throw that in there. And our local coach, Audrey Moyna, is there helping us get things set up already. So Audrey, thanks for that. And so glad everybody is able to jump in. Anna, welcome from Greece. Hope you are staying cool. I live part of the time in Bar, Montenegro, and I know it is not very cool right now, and problems with wildfires in that area, sadly. And so that's, I mean, I wanted to throw that in there, but kind of to get back to your story. You've done all this stuff to support Tiffany, but this isn't what your actual real life job is it?
No, it's not. So I have a real life a job, but like I slowly I would love to transition full time. But I'm just like for right now, all I do is like I'm helping friends and family with their beloved pets. So that's what I'm at right now. But the fact that and all of them know Tiffany, so they know how healthy and how well taken care she is. So I think that's my my window of like people just look at her and they say, well, I mean, can you help me? And then I that's how I do, like word of mouth. And for now, that's where I'm at.
That's amazing, and that's great because we all have to pay in the bills for sure. But I mean,
Yep.
Tiffany is literally your poster child for
Yes, she
how
is.
these techniques work, and that's
Yeah.
absolutely amazing. So that's so you didn't. Do you have a medical background at all, or
I do not have a
no?
medical background. My background is in economics and advertising. So I never had anything like related to biology or nutrition. And and again, like when Tiffany came into my life, she was a complete alien. I had no idea how to take care of a dog, and everything that I learned in the past 2 years. She just turned three
That's a
years old now, so
That's beautiful, beautiful. And that's part of what I wanted to get across. While the course is certified or accredited for 40 CE credits for veterinarians and veterinary technicians, so many people going through the course don't have a biology or a medical background. And it definitely takes a little bit of digging to get through the material,
mhm.
but it is doable. And I think that's part of what our community is able to do, is to help support each other when it's like, wow, what the heck is Dr. Ruth talking about when she said this? So, and that sounds like that's part of what you found was helpful within the
Yeah, and I
course.
think to me, like the most valuable lessons that I took is they are very like simple in nature. They can be complex, but they are simple in nature when you look at the pillars of health. If you think of like reducing inflammation, restoring gut health, and helping the body to detox. And then from there, you add some like other simple concepts of like bringing balance, removing everything that contributes to imbalance, and you add what contributes to balance. And if you have this mindset, you can just go anywhere with these simple concepts.
That's amazing. So, since you started down this path, implementing both what you've learned with as a certified professional canine nutritionist and certified holistic pet health coach, what did you start to see with Tiffany?
So I guess what I started to see with Tiffany is, well, first of all, when I defined that she could have a problem, I try to understand what does that mean, right? So what is this problem? Is this really a problem or not? So I started like going through, we consulted with nephrologists and primary care doctors and nutritionists. Dr. Conor Brady in Ireland was helping me, like all these, and then the first thing that I got to mind, okay, we need to switch her from an ultra processed diet into a whole foods diet, because this way we can do the pillar number one is reduce inflammation right from the batch, right? And then when you think of kidneys, you think of hydration. That's the most important thing. So like water. So like let's look, whole foods is more, there's more water, like getting away from dry food. And then you start going to the sets of goals that I established with her primary care doctor, which was, okay, she's young. She apparently has a physical abnormality, but we don't know if she has a disease or if she will ever develop disease. So let's make sure that we build a trend line from all her kidney, blood, and urine markers. So we established some important kidney markers that we needed to test, and we started testing her every 3 months for an entire amount of 2 years. And the important thing is for you to look at the trend line. Is the trend line stable? Is it going up? So she always been completely stable, so her markers never change. So that means that we are doing the right thing. And that's the most important thing, is for people to understand, because dogs are individuals, right? They can have different markers. They can be high. You can take a dog to get a blood exam and the dog like walk to the clinic and drink water, so it's a little dehydrated, so maybe the markers will be a little higher. And the context is like seeing the whole picture along a period of time. That's how you build understanding of the values and like how healthy your dog is evolving. So those are the things that we started looking at. And then we started to see like Tiffany's, Tiffany used to have like this, she's a white dog, right? So she used to have like the tear issues. So when she was a baby, we were constantly cleaning her eyes and everything. Once we switched to whole foods diet, and when we started to add omega-3 fatty acids and have this clean lifestyle, we like substantially, like she's a completely new dog. Like her eyes cleared, like I show pictures. So when I had my first few consultations, that's the first thing that I show, is a contrasting picture of Tiffany when she was a baby on kibble with her like eye tears like going down her face, and Tiffany after switching to a better lifestyle with whole foods and her eyes completely cleared. And people say, oh my God, this is crazy. And that's how we started to see her energy level and like her poop, talking about poop, like it completely changed. Like if she has like perfect poop, she never has any, like now she doesn't have any problems with diarrhea or anything. Like all these things were accumulating and we were really seeing results with that.
That is just amazing. And it was very simple things to change, yeah?
Very simple things. And like, even for people, they tell me, okay, I don't have the time to switch to kibble. What should I do? And I try to, okay, you can add like easy things. Hydration is the number one thing. If you have a dog on dry food, if you can at least add something like bone broth or like something, water to the bowl, that's just one thing that will be very important, and it will make like a dramatic change in your dog's life with like very easy, simple steps.
And that's so cool. Now, one of the things you said earlier is so important. You worked out a plan with your veterinarian about how
Yes.
you would monitor Tiffany. So how hard was that conversation?
It was, well, so when we started that conversation, I was still not very well versed in like in dog health. So it was more of a like inquisitive thing, because some things like my gut instinct like was requiring more answers. I never like take anything for granted. And I think that's one thing that I learned. Like the most important thing when people call themselves a pet parent 2.0 is to make sure you don't need to know everything, but you need to ask everything. You need to read about it. You need to be inquisitive. You need to, like, if something like doesn't seem right, dig deeper and you'll find answers to that. So that's a very important thing. And the doctor that was treating Tiffany, he was very like, I told him that I wanted to switch to Whole Foods, and he was like a little, oh, I'm not sure. But like I said, I was going to do everything that I could to learn everything that I could. And I was going to assemble a team that could help me from all facets, like nutritional, nephrologist, and primary care, and holistic. And he believed me, and he saw that I was really immersed into this whole endeavor. And but it was hard. Once we established the actual like health, the blood and urine markers, that she was stable, and then you keep going. And then I established like diet plans that were very like, so sometimes I would get into like rabbit holes, right? I have like this issues that I either go into Dr. Ian Billinghurst, or go Stephen Brown, like, and like sometimes in the middle, sometimes, oh my God, and then I learned about ADF, and I connected with Dr. Susan Recker, and I started to use ADF to guide my recipes. And then things just start just getting easier and easier, and you just like one step at a time. You don't learn everything at once. It's a journey, and you just go one step at a time.
And that's so true. And for those of you that don't know ADF, that's Animal Diet Formulator. And it's very cool because they've got it set up so that you can be a pet parent and just want some way to get started with, creating recipes. Or you could be a professional nutritionist, canine nutritionist, and use this. They have different levels of access. It's a great program. I use it as a basis for formulating all of the original Crock-Pot diet recipes as well. And it's great. Dr. Recker is a really helpful and very responsive too. So that's cool. So what does your vet think now, looking at Tiffany?
So my vet looks at Tiffany, and he really doesn't believe, but like he says, so keep doing what you're doing. Don't change anything. Some of them, they look at so like she has this kidney issue, right? So one of the most important things besides like whole foods diet and hydration is dental health, because that's what really freaks me out, because dental health is very important to maintain cardiac and kidney health. So every time we go to do a checkup, I make sure that we check Tiffany's teeth, and I do brushing, and I do like a whole protocol for maintaining her gums and everything. And they don't believe that she's like 3 years old and she has absolutely like very like perfect healthy gums. And thank God we still don't have any issues with having to schedule dental cleaning and anesthesia. So for now, like, we are doing really well.
That's amazing. So it's really funny. So most of the coaches have, an experience with their veterinarians where the veterinarian's like, no, that's not going to work. And then it's like, well, whatever you're doing, don't change it. And then finally, sometime down the road, then the receptionist calls you and says, hey, I got this lady who, so, and that's the thing, is that the vet, and then the vets do sometimes are like, I don't even know what to do with this dog. Can you help me out here? But that's beginning to happen, as the veterinarians are beginning to refer to our coaches, because they have a different set of tools that most veterinarians don't have access to. And God bless them, because they are really struggling to keep their heads above water right now in terms of keeping up with the patients they're seeing. So it's difficult. And I've been in those shoes where was working 80 to 120 hours a week, and then trying to learn Chinese medicine on top of that. And most folks are, they don't have the drive or the insomnia that I had, that I could stay up till 1 o'clock in the morning and do the coursework and then still get up and go to class the next day. But that's so cool. I mean, you're doing all of these things proactively. If you keep the dental health elevated and clean and beautiful, then the chances of Tiffany developing kidney disease complications are minimized tremendously. So well
And it's
done.
funny because sometimes now I even contribute and give like an advice to Tiffany's primary care doctor. We went to the doctor a while ago for just for a checkup, and then she was talking about this other dog. She was late because she was talking about this other dog that has like this major like sensitivity and allergy problem. And then I was talking to her about Glacier Peak sensitivity test. She had no idea. She never heard of Glacier Peak. I was like, "What do you mean you never heard?" So I talked to her about you. Like she researched about Glacier Peak, and she's probably like using it now. She had no idea. So I was giving her all tips about a elimination diet, and like it was funny to be talking to a primary care vet, and like in little me on the other side, like being able to contribute to give her an advice in terms of a elimination diet and sensitivity test.
That is so cool. But I mean,
Yeah,
basically, you're offering your advice out of humility and out of the desire to make the life of other pets better. And that's so cool that she was in the headspace to take the advice
yeah.
and check it out. So there you go. It's just like little tidbits until finally, hey, would you like some help formulating those diets?
Exactly.
Um, yeah, yeah, and that's the thing. At this point, you can do raw diets, you can do cooked diets, and you can do everything in between based
Yep.
on the knowledge that you've gained. So that's
Exactly.
amazing.
I mean, every dog is individual, so each one will respond better to a certain type of diet, right? But it's important. Like Tiffany, she eats the crock-pot diet. She eats raw. She gets a mix. But sometimes, if she's alone with my husband, I hope he's not watching. But like I like try to make as simple as possible for him, and like I make sure that she gets like amazing commercial brands. Like we use Goodness Gracious. I mean, and then I just try to make it as simple as possible for him because I'm not gonna have him like cook a crock-pot diet or like balanced fats or everything. So I just make sure that it's as easy and simple and healthy for her in an easy way. But I love being in the kitchen. I love preparing her food. So for me, it's just like this is therapeutical. So like I enjoy doing that. I enjoy like selecting proteins and alternating between ruminant and poultry and balancing the fats. I love doing all this.
That is so cool. And that's the thing. It's like, that's what you love to do, your husband not so much. So the deal is make it so that it's going to work
Exactly.
on a
Yep.
consistent basis for Tiffany. Exactly. And what, your point exactly earlier, I can't possibly, cook for her. Do something to
Yes.
moisten the food.
Yep.
If you're still using a dry food, use like Goodness Gracious is an amazing
Yes, it
line
is.
of lightly cooked diet. It's
Yep.
frozen, it's beautiful fresh food, so it's really easy for anybody to get started
Yep.
with. And I think
And,
that's the deal. You get hooked on it and then you kind of
yep.
figure it out from there.
Exactly. So that's the way to go. You just add one. If you cannot add a lot, if you cannot be as crazy as I am about like food and like building a diet plans for Tiffany, you just start small. Just add one thing at a time. It will make a difference.
Exactly. And that's kind of it. So, if you are willing to start with home cooking, that's exactly what the original crockpot diet was for
Yes,
too, is that
exactly.
I designed it so that people would be able to do it, um, and be able to carry it off on, on a regular basis without it being super stressful. And it is home cooked, so it's easy to do it in a slow cooker. You can make a batch, freeze portions of it. I mean,
Exactly.
it's just crazy. We were able to, when Mary Jo and I still had 5 dogs and 5 cats, we were able to knock out food for the month in about 4 hours one Sunday a month. So it was just a matter of getting in it and getting it done. So
And
that's
the
all
most
good
amazing about
stuff.
the most amazing about the crockback diet is that it's not a rigid thing, right? You can adapt to like all kinds of issues. Like you have a healthy dog, a young dog. you have a dog with kidney issues or liver, you can adapt in the way and you control the ingredients. I mean, that's the most important thing for me, is control the ingredients, and you adapt any way you need for your dog. So that's the most amazing thing about it.
Cool. Yeah, and that's kind of part of how it makes using the results of those Glacier Peaks pet wellness scans so easy. Because, okay, now you can get some results on what your dog may be sensitive to, what your cat may be sensitive to,
Right.
and then design a diet using the template. Okay, Fluffy can't have pork or chicken or salmon. So, okay, I'm going to choose beef and turkey and some whitefish as the proteins, and then really just, design the diet based
Yep.
on precisely what your dog or your cat needs.
Exactly.
And
And
that's it.
variety,
Same thing with
right?
raw feeding. Yeah,
Yeah. And variety. I mean, that's the most important thing. Variety, variety, variety. Just alternate and make sure the nutritional profile is as diverse as possible.
exactly. And that's a great point too, right? Because we've been trained to think that, oh, every bite has to be complete and balanced for all life
Yeah.
stages.
No.
But really, I mean, we don't feed ourselves like that.
Exactly. Yeah.
Otherwise, we'd be eating probably power bar squares for breakfast, lunch, and dinner.
Yeah.
And that's not healthy.
Yeah.
So,
Exactly.
if we take the approach of nutrition over time, then I think that
Yep.
that lends to a more interesting diet and a more diverse microbiome.
ADF has the ability to make you go a little crazy. Sometimes I would see myself, oh my God, she's missing manganese, she's missing choline. But then you realize when you start looking at the profile like in a longer period of time, it ends up balancing off. And it's a guideline, right? So obviously sometimes I will prepare a meal that will be short in choline, short in iodine. But then at least if I have that guideline, okay, that's what happened today, and then tomorrow I can focus on other ingredients to compensate for that. So I use it as a guideline to help me to guide my decisions in terms of nutrition.
Right on. So, if somebody was watching this today that just got the news that their dog had or their cat had early kidney disease, what are the top three suggestions you'd give them?
I think the top three suggestions would be switching to a whole foods protocol in case you're still feeding dry kibble, because not only the ingredients will be less inflammatory, uh, adding water is the number one. If I had to give you like one tip, like forget about everything else, make sure that you add water to the bowl. The dog will definitely need to be hydrated always. And filtered water, never use tap water that can have heavy metals, to make sure that you have like the best water possible that you can add to the bowl. Switching to a whole foods protocol. Maybe if you want to go like a little bit further, you can either do an elimination diet to identify proteins that could be causing sensitivity, increase inflammation in your dog, or do a glacier peak. They'll give you insights on like what you should be watching for in terms of sensitivities. And then if I were to add one supplement, only one, I would say omega-3 fatty acids. And I'm not talking about short chain fatty acids. I'm talking about EPA, DHA, long chain fatty acids, fish oils. That's what I would always encourage for any dog with a kidney challenge. Omega-3 fatty acids is going to be very important in your life.
Amen to that. I mean, that's been shown, omega-3 fatty acids have been shown to support kidney disease time and time again, along with almost every other disease that is based in chronic inflammation. So, really, really critical to add those in. There's a multiple options. The most sustainable option is anchovy mackerel sardine based, but
And
there
calamari
for
as
pets
well.
and calamari, yeah,
Yeah,
exactly, calamari, and
yeah.
honestly, the most sustainable is algae, but it's
Algae, yeah.
difficult to obtain sort of that higher doses of omega-3 fatty acids with algae, but we're working on it. because
Yep.
it is sustainable. And I think if everybody in the world were eating an adequate amount of omega-3 fatty acids, there's no way that there's enough fish in the ocean to take us
Yeah,
there.
I agree.
So that's where algae is going to be critical in the future.
And if I may add one more
Yes.
important advice that I already talked before is make sure that you talk to your primary care vet and do blood panels and urine panels and establish blood and urine markers that are important to kidney health and build a trend line to understand exactly the evolution of the dog in front of you. If if the trend line is stable or if it's increasing, and then you make adjustments uh, to respond to these increases.
And I think that's so critical because so much of kidney disease, we can see the numbers change, but the dog looks fine. And
Right.
the thing that's so important is to be able to intervene before the dog doesn't feel well and to make some changes in how they're eating, what they're taking to help prevent things from getting worse in a hurry. So excellent, excellent advice.
And
Um,
gut health, of course, right? Because that's going to
yeah,
be like one of the top things for any longevity program for any human being, for any mammal, is gut health.
amen. So, and that's it. I mean, if we can address all of those things, like you said at the beginning, controlling inflammation, supporting gut health, and supporting the ability of the body to detoxify both
Right.
through the kidneys and the liver,
The
then
liver, yeah.
we can make amazing, amazing changes in how what the projected outcome is and what the actual outcome is for the pet. So excellent, excellent choices. Uh, so for those of you, again, I'm going to put the link up here. If you want to get in touch with Fausto, he is clearly a wealth of information, especially in the front of kidney disease. Is extremely passionate about supporting pets in general, but this has been his passion line, is to figure that out. So check that out. And then again, for those of you in the Chicago area, we are so delighted to put together this Know Better, Do Better presentation for September 8th. We would love for you to join us. The ticket cost is less than $30. It's going to benefit an amazing rescue organization there in the Chicago area, uh, Canine Civilian. Great folks doing good work. So that's what we've got for you today. Really delighted you could make it, Fausto. Thanks so much for the information you are providing.
No, thank
In
you so
this,
much for everything you do and for everything you represent and for everything you have done for me and for thousands of pet parents around the country.
it is my pleasure. All right, that's what we've got for you this week. We will see you next week with more cool stuff.